Today our topic is spondylolisthesis. As you can appreciate here, there is the anterior listhesis of the upper vertebra over the inferior vertebra. We can classify this by the Meierding's grading, in which we have the 5 grades. In grade 1, there is 25% anterior listhesis. In grade 2, 25 to 50%. In grade 3, 50 to 75%. In grade 4, 75% complete. And in grade 5, there is 100% spondylolisthesis. How we will check the spondylolisthesis by the imaging? On X-rays spine, the dynamic views, the flexion extension views, on CT scan, on as well as on the soft tissue integrity on the MRI. So, what are the clinical signs and symptoms if a patient becomes a victim of spondylolisthesis? There is stiffness in the muscles and neurogenic or vascular claudication. How we will differentiate between the neurogenic and vascular claudication? In neurogenic claudication, there is the dermatomal distribution, and in vascular claudication, there is the sclerotomal distribution. In neurogenic claudication, there is no problem in the distal neurovascular bundle, but in vascular claudication, there is foot pillar, and there is also the stocking distribution in the vascular claudication. As far as the treatment is concerned, if the disc space and this is the disc space, you can see here, and this is the foramen. If the disc space and the foramen is intact, then we do the direct decompression by the laminectomy, and after that we will do the posterolateral fusion by the transpedicular fixation or via the interbody fusion. This is the interbody fusion via the posterior lumbar interbody fusion or transforaminal lumbar interbody fusion. And if the disc space is not intact, if there is loss of disc space height and foraminal stenosis, then we do the indirect decompression. What are the procedures of the indirect decompression? Procedures to increase the disc space height, and thereby indirectly decompress the neural foramen. And these procedures are lateral lumbar interbody fusion, anterior lumbar interbody fusion, and axial lumbar interbody fusion. And the last but not the least is the third procedure is the procedures to increase the limitation of extension, in which we will do the limitation of extension by interspinous spacer. This is known as X-stop. So these are the different clinical treatments and surgical treatments which are available. Let's talk about the clinical treatment. These are the surgical treatments. What are the clinical treatment? The clinical treatments are non-steroidal anti-inflammatory drugs and Boston brace, which will be wear for 3 months. These are the different kind of treatment options which are available. So, take care of yourself. Thanks.